Borderline personality disorder. Today, I'll be talking about borderline personality disorder, or BPD. In this presentation, I'll explain what BPD is, how it affects a person's emotions, behaviors, and relationships, and go over common signs and symptoms. I'll also talk about risk factors, how BPD impacts people and their families, and ways it can be managed. Lastly, I'll explain why this topic is especially important for teens. BPD stands for Borderline Personality Disorder. It's a mental disorder that affects how people feel about themselves and others. People with BPD often experience intense emotions and unstable relationships. Their symptoms can vary. Some people may act more impulsively, while others may withdraw emotionally or feel anxious. BPD affects about 1 to 2% of the population. It is diagnosed more often in females, but some men may go undiagnosed. Some key symptoms include intense mood swings, fear of abandonment, unstable relationships, impulsive actions like spending extra money or taking risks with the law maybe or with drugs. And others may find it difficult to control their anger, or they could feel empty inside. These symptoms can make daily life and relationships a lot more difficult for those with this mental illness. BPD is more common in people who have experienced trauma, neglect, or have a family history of mental illness. There are stereotypes that people with BPD are overdramatic or attention-seeking, but these are very inaccurate and very harmful. Symptoms usually begin in teens or young adults, and BPD occurs across all races and socioeconomic groups, which means there is no specific group that is at a higher risk for BPD. It is completely genetic and trauma-based. BPD can lead to impulsive and harmful decisions. People may struggle to maintain relationships due to emotional instability. It can cause emotional distress, miscommunication, and conflict. It also affects family and friends, which can create stress for everyone involved. Other effects include unhealthy coping methods, lack of support systems, and connections to trauma. BPD cannot be completely prevented. However, early support can help reduce risk. This includes a stable home environment, emotional support, and learning coping skills. Programs like early intervention and increased access to therapy can also help. There is no cure for BPD, but there are steps after diagnosis. These include getting a professional evaluation, starting therapy, developing coping strategies, possible use of medication, although there is no medication specifically for borderline personality disorder, but a diagnosis is done by a trained medical professional, and self-diagnosing is not a real diagnosis. Treatment depends on the person and the severity of symptoms. It usually includes therapy and support systems, but there are different levels of care. Outpatient therapy, mental health programs, and inpatient care for severe cases where they need an extra, more one-on-one, closely related type of therapy. The positive effects of treatment include better emotional control, improved relationships, and reduced impulsivity. However, there are some negative effects and some challenges, like therapy takes time and medication can have side effects. Help is available from therapists, psychologists, psychiatrists, and school counselors, which can help to understand your symptoms and find coping mechanisms. Therapy is the main treatment, especially DBT, which is dialectical behavior therapy. Medications may include antidepressants, mood stabilizers, and anti-anxiety medications, which are some of the things that can be caused by borderline personality disorder, but are not full treatments for borderline personality disorder. Now, why should you care about this? Well, symptoms often begin during the teenage years. Also, if you figure out that you might have borderline personality disorder, getting help early can prevent things from getting worse. Teens may experience intense friendships, identity struggles, school stress, peer pressure, and social media effects, which can make emotion regulation more difficult. And if that is layered on top of borderline personality disorder, getting diagnosed and getting help is one of the most important things that you can do as a teenager. Now, why are teens at risk? Well, teens are most vulnerable due to family conflict, trauma or neglect, lack of emotional support, bullying, brain and emotional development, less coping skills, and a greater sensitivity, which is mostly due in part to the fact that teenagers are still growing and developing, and they're not going to be as emotionally aware as an adult. Some very important statistics are 75% of diagnosed BPD cases are women. This means that the majority is women, and in order for men to get diagnosed, they have to understand themselves and look for themselves and look for these symptoms in themselves so they can hopefully get set up with a therapist, because there are most likely a lot of undiagnosed men. Also, 78.2% of people with BPD also struggle with substance abuse. This is a very scary statistic because it basically says that those with BPD are at a higher risk to use substances, which likely happened because they did not receive the help that they needed. Continuing on with that theme, 1 to 85% of people with BPD will attempt suicide. That is the overwhelming majority of people with BPD that are attempting to kill themselves and hurt themselves because of their emotional state, that they need intervention, they need help so that they can get better and not want to hurt themselves. Continuing on with some key statistics, 33.1% of people diagnosed with BPD also have eating disorders. This shows how BPD can cause other mental disorders that are linked to BPD. Continuing on with that, 84.8% of people with BPD also struggle with anxiety disorders, which continues to show how BPD can affect those with the disorder without just having the symptoms of BPD. Also, 8 to 10% of people with BPD will pass from committing suicide. This statistic might seem daunting, but it should inspire you to help those with BPD and to bring awareness so that this percentage, this statistic, can be brought down. And to those with BPD, the statistic is just a statistic, but it still needs to be informed so that everyone can better themselves into not ending up being a number in a statistic. Continuing on with the population comparison, this is the percentage of people with BPD compared to America. So America, the percentage of the population with BPD is around 2.7%, compared to the United Kingdom, which is only about 2%, which is even less than Norway and the Netherlands, which are about 0.7%, and the Netherlands is about 1%. This is likely due in part to America and the United Kingdom having a more open and well-known spot with mental health and BPD, but Norway and the Netherlands kind of show that there is a lesser amount, and that should really help us to bring awareness so that everyone who is going undiagnosed in these countries can get the help that they need. And here's why we're excited. Thank you so much. All of these sources showed a clear description on what BPD is and how it affects those with the disorder. I used reputable sources like Mayo Clinic, and they all helped me to better understand truly what BPD is. Thank you for listening to this, and remember to complete the guided notes and play the GIMP kit the booklet that is attached.